Good afternoon, everyone. Thank you for joining. We're going to give folks just another minute or two to join, and then we'll get started.
Hello.
All right, good afternoon. We'll go ahead and get started. So thank you so much for joining our Lunch and Learn today, focused on firearm injury communications. We appreciate that you're willing to spend your lunch hour with us. So my name is Erin Austin. I am an epidemiology program manager within the Office of Family Health Services at the central office. And this Lunch and Learn, as well as our firearm injury communication effort, is really a collaborative effort between multiple offices in the central office. So Office of Family Health Services, Office of Epidemiology, and Office of Communications. So you'll hear from a few of us today. We have Lauren Yerkes, who is our injury and violence senior epidemiologist here in the Office of Family Health Services. You'll also hear from Meredith Davis, who is our enhanced surveillance epidemiologist with Office of EPI. She resides on the enhanced surveillance team, which includes the Essence syndromic surveillance system. And you'll also hear from Mel Gilbert, who is representing our communications team as well. We are recording today's session, so if anyone misses it or you want to go back and watch it later, we will be posting that recording on Train. All right, so for today's Lunch and Learn, our main objective is to increase the capacity and confidence among our VDH staff, both at the local health districts and central office, to be able to communicate around firearm injury. We know that this is a sensitive topic and often a politicized topic, and it makes communication really difficult. And so we're hoping that through today's Lunch and Learn, we can kind of help you know where to find firearm injury data related to injuries and deaths, how to communicate about firearm injuries and deaths within your communities and with your partners, and then also know where to find these resources when you need them. So this is our brief agenda for today. We're going to cover some background, we'll look at some data, and then we'll go into our communication resources and also have a chance to answer questions at the end. If you have questions throughout the session, please feel free to drop them in the chat. Our team will be monitoring it, and we may be able to answer them as we go, or we'll save them for the end for the Q&A session. So going into a little bit of background, firearm injuries and deaths are a public health problem affecting communities in Virginia and across the United States. Prior to 2020, public health surveillance of firearm injuries was limited. As you may know, that federal funding was restricted between the late 1990s and 2019 to be spent on gun control research and related work. And so we really didn't have funding in the public health space related to doing surveillance for firearm injuries, but we were very fortunate to receive a federal funding award through CDC in 2020, which is called the Firearm Injury Surveillance Through Emergency Rooms, or FASTER cooperative agreement. And so we had funding for 3 years, and that really let us enhance our surveillance efforts here at VDH Central Office. So when we were conducting surveillance, it was a collaboration between Office of Epidemiology and Office of Family Health Services. And the goal of the funding that we received was really just to improve our surveillance and data analysis so that we could describe firearm injury trends, we could identify populations that were disproportionately impacted, and then be able to publish and disseminate firearm injury data products to inform our communities, inform our partners, inform our local health departments. And so through those efforts, we've been working to build our sort of compendium of firearm injury resources, both data and communication. And when we're doing surveillance, we do use multiple data sources to understand the firearm injury continuum. And Lauren is going to talk a little bit more about what our data looks like and also where you can find it. So I will pass it over to Lauren.
I think,
yeah.
Yeah,
Oh,
that's
sorry.
okay. No problem. Yeah, so I'm just going to give you all a little bit of background on the trends that we see in the firearm injury data in Virginia. But before we kind of dive into that, it's important to know that when we are talking about firearm injury, we're talking about injuries of all types or intents. And so that includes those that are listed here: intentional, self-inflicted, or suicide, assault or homicide; unintentional, so those injuries that happen not on purpose, as well as injuries that result from legal intervention or war, and those for which the intent is undetermined. Next slide, please. So Aaron was talking about looking across the continuum of data sources. So VDH uses 3 data sources to provide a picture of kind of the spectrum of firearm injury burden. And those are emergency department visits, non-fatal inpatient hospitalizations, and deaths. And these data sources kind of differ slightly in the populations that are included. So I just wanted to kind of go over that just so you know what they're representing. So the ED visits are visits that occur in Virginia among Virginia residents as well as out-of-state residents. The hospitalizations are those hospitalizations among Virginia residents in Virginia licensed hospitals. And then finally, the deaths are Virginia residents, regardless of whether the death occurred in Virginia or out of state. And importantly, among these 3 data sources, the deaths is the only data source that can be used to stratify by intent of injury. And we'll talk a little bit more about that in a minute. Next slide, please. So just as a really full overview, on average, we see 7 emergency department visits, 2 hospitalizations, and 3 deaths every single day due to firearm injury. So the burden in Virginia is significant. And on the next slide, you'll see kind of what we're seeing over time. So just to kind of orient you, this graph is showing data from the 3 data sources. So the ED visits is in the dark blue, the hospitalizations is in that lighter blue, and the deaths is in that mint green color. And over this full time frame, we've seen overall an increase in burden across all 3 data sources. But as you can tell from the shape of the graph, the sharpest increase was observed in the ED visits. So those actually increased about 41% between 2016 and 2021. But over the past couple of years, we've seen a little bit of a decline. So that's an encouraging sign. Between 2016 and 2022, the hospitalizations increased about 11%. We don't yet have the data for 2023 available. So we'll be able to update that when we do. But deaths also increased about 11% from 2016 to 2023, looking at the preliminary data. So the overall message is that the burden is increasing, but there are potentially some recent signs that maybe we're seeing some declines. Next slide, please. We do know that some Virginians experience more firearm injuries. So approximately 85% of ED visits, hospitalizations, and deaths are occurring among males. We also know that 15 to 24-year-olds have a higher burden than other age groups, and you can kind of see the percentage breakdown there as well. And then among racial groups, Black or African American people have higher burden of ED visits and hospitalizations, and white people experience the higher burden of deaths. Next slide, please. So this graph shows the firearm-related deaths by intent. And as you can see here, about 62% of the deaths by firearm are suicides. So that's approximately 6 in 10. A little bit over a third are homicides. And then the remainder are from the other intent types, unintentional, legal intervention or war, or undetermined. But as you'll see on the next slide, the trends are different by intent. So between 2019 and 2022, we observed a 62% increase in homicide. During the same time period, there was a 22% increase in suicide, while firearm-related deaths that were unintentional remain stable and make up a much smaller proportion of the firearm-related deaths. And what we observed here in Virginia is consistent with other national trends as well. Next slide, please. So we're going to kind of shift over to where you can find the data products and resources for yourself. So this QR code will get you to the Firearm Injury in Virginia website, and it's also kind of listed below there on the slide, and we can pop it into the chat during this meeting as well. But that's where we host the VDH data products. So I'm going to kind of walk through each of these briefly here. The first is the Firearm Injury Emergency Department Visits dashboard. So that one includes counts and rates and demographic information. It's updated monthly to include data from the previous month, and you can filter that dashboard by health district. So this one is the most timely data source for firearm injury data. So if you're looking for the most up-to-date information, this would be a good place to go. The second dashboard is for firearm-related deaths. So that one has counts and rates, as well as information by intent and demographics. And data are available by health district on this dashboard as well. This one is updated annually. So we expect in like October, November timeframe to be able to update it with data from deaths that occurred in 2023. So this is the best data source to use, particularly if you're looking for information about intent, since deaths is the only one where we can stratify by the intent. The third data product is a data brief that our kind of collaborative team produced during the FASTER project. And this one's a static report that has a variety of insights about it, comparing the burden of firearm injuries across those three data sources of ED visits, hospitalizations, and deaths. So I would recommend this one is the best one to go to if you're looking for additional context about the data and more of an integrated look across those data sources as well. And then finally, we collaborated with the Office of Communications, graphic designers to develop some infographics that were based on firearm death statistics. And the focus here was just brief messaging for a lay audience. So those posters are available to download, as well as you can request print copies of those posters as well. And then on the next slide, you'll see kind of a snapshot of what the firearm injury website looks like. So the data products that I was just describing are linked on those dark blue buttons there, so you can get to those. And then, although you can't see it on this screenshot, if you scroll a little bit further down on the website, that's where you'll be able to see the posters for download. So those are available there, all on that website as well. And then the final thing I wanted to mention is that if you don't find what you're looking for firearm injury data, there is a link there to request additional data. It may or may not be something that our teams can get, but we'll do our best to meet your needs to get that firearm injury data that you're looking for. So I think I'm going to pass it off to Mel to talk a little bit more about the communications piece.
Hello, would like to talk with you all a little bit about the Comms Hub and the role that it plays in this information. I'm going to put a link in the chat to the page on the Comms Hub where this information is housed. One of the things that we wanted to do was have communication resources that are readily available for you all to use to help you more effectively communicate about firearm injury as a public health issue to both partners and to the general public. And we have some materials available on the Comms Hub now, but as things are approved and created, we will add more to the page. We do send out a weekly newsletter from the Comms Hub that will have any new materials included in there. So if you are subscribed to that, then you will get that information right away. Next slide, please. There's a QR code there that will take you to the firearm injury page. And the information that we have on there available now includes communication resources, such as a language best practices document. And that document goes over terminology to use, terminology to avoid, and the rationale of why that is an important choice to make. It also offers print resources such as the posters that Meredith mentioned earlier. Those are for professional print services, but we also have some that are less dark color focused so that you can print them in a regular office printer as well. So we do have resources for both of those. We also have web resources, so an easy place to get resources both from CDC and from VDH. That includes the dashboards that Meredith mentioned, but also a couple of dashboards and other resources from CDC. One of the nice things about the information that's on the Comms Hub is that it has a brief description of what the information is, what you'll find at that link, but also it gives you activation information. So you can read there exactly how to use or give you recommendations for how to use the information that you'll find on there. And with that, I will pass it back.
Mel, do you want to we can do like a quick little tour
Sure.
of the Comms Hub if you're okay. I can pull it up or you're welcome to, whatever works.
Sure, go ahead.
All right, so here's the Comms Hub page for firearm injury, as Mel was sharing. So it does have section information about communication resources. We're actually going to go through this document in a minute related to best practices for communicating. It has the print resources. So if you see the dark colored poster background, that means those are the professional size printing options. We actually did work to distribute laminated posters to health districts. We tried to direct them to the population health manager if you had the one, or community health manager, or health district director if one wasn't available. So hopefully a lot of districts have these somewhere in your offices. If you want to use them, they're available. We do have some additional already printed here at central office. So if you are really, really interested in having some that are professionally already printed and laminated, please feel free to let us know, and we can try to coordinate what we have left in stock to get those available out to the districts. As you scroll down the page, you'll see the print resources with a plain white background, and these ones are the ones suitable for printing in office, just on regular office 8x10 paper, or 8x11, sorry, paper. So that is available as well. And then at the very bottom are the web resources, so links to our dashboards, links to prevention resources, both VDH and CDC. And as Mel mentioned, we will be adding additional resources as they are approved. We have some that are currently in process, and hopefully we can get those added at some point in the near future. Any other comments from the team on the Comms Hub before we move on? Okay, I'll switch back to the slides.
Can I add one thing, Erin?
Absolutely.
When you are navigating to it, if you go to the Comms Hub and click on Health Topics, it's listed, the different health topics are listed alphabetically. So it's under firearm injury and that drop down. So you'd be able to find it there.
Great. And now we'll move on to our language best practices.
Thank you so much. So as we were talking about earlier, we will have language best practices on the Comms Hub, but I want us to go through a few of these terms, what maybe to avoid using and using instead. So the first one that I want to point out is saying the word firearm versus the word gun or weapon. So, and then along with that comes firearm injury and death versus gun violence. So we hear a lot in the media the term gun violence, but firearm and firearm injury and death, they're more neutral terms. They don't criminalize gun owners. And the other piece of this is that the term gun violence can really downplay or diminish firearm suicide. As Meredith mentioned earlier, 6 in 10 firearm injury deaths among Virginians are due to suicide. So we don't want to downplay that very important issue or piece of firearm injury. The second one I want to highlight is kind of in the injury space. So when we talk about injuries and we hear about injuries, a lot of the time we say accidents. But really, accidents are known as random, unavoidable events. You can't avoid them. They happen. They're not preventable. So what we encourage instead is that instead of using the term accidental, unintentional shows that the injury, it wasn't meant to be on purpose, but it also is preventable. So unintentional is a better term to use when you're talking about firearm injuries, like somebody unintentionally was cleaning their firearm and it discharged, something like that. Finally, we'll talk a little bit about people first language. A lot of us are already very familiar with this, but using at-risk or high-risk populations or firearm victims. So we use the term people at risk for firearm injury and death, or people who experienced firearm injury. It is more equitable and it's less likely to stigmatize people who did experience a firearm injury or criminalize offenders, perpetrators, or other groups of people. So those are some things that we want to highlight when we talk about firearm injury. Next slide, please. So when we're framing communication around firearm injury, we want to highlight a couple of things. So the first thing that we want to highlight is that we want to describe firearm injury and deaths as a public health problem that is preventable. A lot of us are familiar with the SEM or the social ecological model. There are individual, all through societal risk factors for firearm injury, but there are also individual and societal protective factors. So things like green spaces or safe storage of firearms. So firearm injuries are preventable. Acknowledge that risk factors for firearm injury and death are cross-cutting with other types of violence. So if we're talking about intimate partner violence, firearm injury impacts that. Sometimes an intimate partner violent event also includes a firearm. So really kind of thinking through and trying to make connections between the risk factors that cover injuries and violence. And finally, and I'd say a really, really important piece, is to be empathic. Have empathy and continue to express empathy when you're talking about this particular topic. It affects not only the person who experienced the firearm injury, but their family, friends, their faith-based communities, and their communities at large. So really important to come with that empathy first. Next slide, please. So really, here are the key messages. The first one is that firearm injuries are a public health problem. They can be prevented, and they can affect anyone. So we talked about the empathy piece. It doesn't matter what identity that a person has or a community has. It can affect anyone. It includes all types. So we're not just talking about assaults or homicides or suicides. All types are included here. And that it can cause trauma and may continue to cause trauma long-term to the injured person and their family, friends, or community. Next slide, please. So with that, the other piece that I want to highlight is, as we talk about trauma, May is actually National Trauma Awareness Month. And so what Sherelle, who's on the call, one of our amazing comms people, wrote this blog post, which is going to be published on May 15th, that talks about May as being National Trauma Awareness Month, identifies and defines what trauma is, and that firearm injury is a large public health issue that can cause and does cause trauma to communities. And so kind of walking through that piece, and also links to prevention resources as well for firearm injury and other types of injury or violence. Next slide, please. The other thing that I want to highlight is when you're talking about firearm injury is to also include some prevention resources. So some prevention resources that we really want to encourage is that you include 988 in your firearm injury communications. It is the Suicide and Crisis Lifeline. There are options to call, chat, or text 988 24/7, 365 days a year for people to be linked to crisis counselors if they feel that they are in crisis. And then secondly, around suicide prevention, we like to link to Lock and Talk Virginia, which is a suicide prevention initiative across the state that encourages safe care and storage of lethal means, which do include firearms and other medications, but really encouraging that activity or initiative through Lock and Talk. Next slide, please. So as we start to close and open up for questions, I do want to highlight a few reminders as we walk through this today. One is that, as we mentioned before, additional resources will be added to the Comms Hub page as they are approved. So that we're working on approval processes for a couple things. And then be sure to coordinate any local health district communication plans around firearm injury with your regional PIO. So very important to do that. Next slide. So with that, we are kind of at the closing of our presentation portion. And so we're going to open it up for questions. I will be reading any questions that come up in the chat, and we'll have our experts answer those, or you can come off mute and ask questions as they arise.
Hey y'all, I just wanted to say great job with this deck and collating this information. I'm always a proponent of, situating the narrative, and you did a really great job of contextualizing and making sure folks understand and use the right verbiage when we're talking about this issue. So I just want to say great job in putting this together. It's really important for me as violence prevention. So thank you.
Thank you so much for that feedback.
Thank you. And I think if you are interested in the slides, we can share those out at least with the group that have registered on Train, because that's how we'll get everybody's email address. So if you've registered on Train, we can share out the slide deck. But as Lauren was going over kind of the communication language. Those are all on the Comms Hub, so you can access those now through the links that have been shared in the chat. But we're happy to share out the slides as well.
Are there any questions from the group today? Please feel free to put them in the chat or come off mute.
There's a question in the chat. Do we have community partners to help with lingering trauma? I had a hard time locating free resources when searching in the past. Which is a great question. Lauren, I don't know if you're familiar with anything, but I think this would be a good health district maybe conversation piece for those who maybe have worked in this space, if they have any suggestions or recommendations for community partners or types of community partners they've worked with.
Yep. So I'm going to jump in again here. So in the violence prevention space, we have the Trauma Healing Response Network. Now we're still trying to get a hold on the documentation that we want to sort of collate and distribute. And I think this information was helpful, but we have tons of partners who are really, I guess, invested and critical in this space in terms of mental health resources and the like. So if you guys just want to reach out to me via chat or email, I'm going to drop my email in the chat here, and we can just kind of maybe talk offline as we get together our documentation. But it was a really important question because even as sometimes our introduction to the impacted is through the firearm injury and or death, it's the work that we do before and after that that is really critical. So I'm gonna just encourage all of you to reach out to me, and then we can talk through what that looks like before we get our documentation out. So I'm gonna drop my information in the chat.
Thank you so much. Very helpful. Other questions that folks have? It can be about anything, firearm injury data, if you have questions about that, communications, etc. Yes. Peter, I see a hand.
Hey, Lauren, can you hear me?
I can hear you.
All right, excellent, excellent. So I have a just a general question. So ED data, do we ever partner with other state aid or local agencies such as state police, local police departments for those unreported, the people that refuse to go to the emergency room to capture any of that data?
So
Hey,
Meredith,
Peter,
yeah.
we do not get that in the emergency department data. I imagine that it's possible we could explore the emergency medical services data, perhaps to try to get at some of that issue, because I don't know honestly like what proportion of firearm injuries would occur and not have treatment in the emergency department. So it's an interesting question. I don't know if anybody else on the call has more information about that either.
Hey, I just want to jump in. So there are two things with that. So VCU has a Bridging the Gap program that works with emergency room data and the like, right? But the RPD and even Henrico PD, even when we try to figure out how to get trauma resources to the impacted, we've come up against some roadblocks and some challenges just in terms of an active investigation and confidentiality. So I know from the police and law enforcement aspect, that data is not readily available, and it's really a difficult time to get that information. So sometimes we go through VCU, but also our Trauma Healing Response Network partners that are on the ground. Normally, they're in touch with the communities we serve. So they're getting the information straight from the families and or folks associated with the families. That's not, necessarily the best way. I would love for us to be able to have a more streamlined sort of, data entry point. That's just not the case right now. So I think that's an ongoing challenge that if anybody has any ideas of how we can be more effective in that space, I'd appreciate it too, because that's been an ongoing challenge for us.
Is that through forms, I'm guessing, when they capture it from the families, the on the ground, and then probably a little data entry after that?
Yeah, so we work with the data group and Catherine Werner and Dr. V. We actually have a red cap sort of repository that we're still refining. This is only the second year of the Trauma Healing Response Network. So we're really trying to get better at capturing the data and how to aggregate that and synthesize it, right? So right now we're capturing that information in red cap and really just figuring out how to parse it out and make sense of it. But yeah, that's really it. And that's not readily available to everyone here, really just our group. And we're still trying to figure out how to process that. So again, anybody who has any suggestions, that would be really appreciated.
That's awesome. Thank you.
Thank you so much. Any other questions? Chat or off mute?
Hey, Lauren, I just want to bring attention to Dr. Spillman's comment in the chat that there is data available through EMS call sheet.
Yes, and I think that was that's a good point. We probably need to work with EMS to see what might be able to be teased out there. So thank you. All right. Well, I don't see any questions in the chat or any off mute questions. So Erin, I will bring it back to you.
Great, thank you. Well, I appreciate everyone attending today's Lunch and Learn. We hope you found some valuable information that you can take back to your work. If you do have any questions, feel free to reach out to our teams through the faster@vdh.virginia.gov email address, and we're happy to assist. And as Meredith mentioned, there is a data request form on our external VDH firearm injury webpage. So again, you can use that mechanism if there's information that you're looking for, but you can't find it, we can try to assist that way as well. And as more information comes on the Comms Hub, we will be sure that goes out in those updates that Mel talked about through the Comms Hub newsletter. So thank you again all for attending today's session. We hope you have a great afternoon.
Thank you.
Thank you all.